Today we are going to talk about fourth wave of COVID and how this COVID is going to affect the school going children. As we know that we have started school all over India and most of the kids are going to the school, but all the parents are having the concern of this COVID infection in the school going children because there are multiple points of contacts. You can start from the transportation, classroom and cafeteria. So today I will speak about it and I will try to answer as many as questions possible. Let me tell you that we are not going away with the COVID. It's going to stay with us for a long time. But we talked about first COVID wave, second COVID wave when we were not vaccinated. So this time we are not going to get a fourth COVID wave, but what we're going to get is a spurts of infection in between. There might be a cohorting of infection and subsequently it will go away. By God's grace, most of the kids has done really well. Almost 99% of the kids had asymptomatic or mild illness without any major issues. So kids are very well protected since beginning when we talk about COVID. And we are going to see the changes in the COVID virus over the time. If there is a significant change in the COVID virus over the time, then we might see a fourth wave of COVID. But at this moment, there is no literature which suggests that we are going to see the fourth COVID wave. We will definitely see some spurts of infection, which we have to actually prevent by doing appropriate or following appropriate precautions. About fourth wave of COVID and involvement of kids in the COVID infection. So remember that most of the kids had an asymptomatic or mildly symptomatic infection. And remember, this is a quite season of other respiratory tract infection also. So not every cough and cold is COVID. You still can have flu, adenovirus, rhinovirus. These are the common viruses which are pretty common than COVID virus in this scenario. So remember, it's not every URTI is not COVID. Is the school safe or it's a hotspot of infection? So all over the world, there is no guidelines or there is no data which suggests that the school is a hotspot of infection. In a low transmission areas like India, the chances of school being a hotspot of infection is very unlikely. If we follow appropriate precautions like hand sanitization, social distancing, and a proper ventilation guidelines in the school rooms. Remember, this is a responsibility of the school as well as us to make it sure that our kids are safe. So I would like to differentiate the prevention of infection in the three stages. One is at home. So as we discussed, make it sure that we as a parents using appropriate precautions like social distancing, mask, hand sanitization when we are going outside, so that we are not carrying the COVID virus in our nose and giving it to our kids. Second thing is when we are going for a trips or a gathering places, kindly reinforce the same thing again and again so that we are not getting this infection from outside. Make it sure that all the parents or all the adults in the home are vaccinated appropriately and keep on reinforcing the kids to utilize the same precautions again and again. So this is about home. Yes, we can use the school transport, but we have to do a certain changes. Like there should be appropriate social distancing that one kid is sitting on one seat. Second thing is, if it is possible to keep the windows open so there is a constant flow of air and the air exchange is good. Again, we have to make it sure that there is a proper hand sanitization as well as masking so that the prevention of infection is better. So definitely we can use transportation with these appropriate precautions. What about the school room? So in the school rooms, we should follow the following things. Make it sure that all kids, all teachers and the other members are using the mask. Second thing is there should be an appropriate social distancing if it is possible. There should be a hand sanitizer which is approachable and kids can go and utilize that hand sanitization again and again. Hand washing facilities should be there. And if possible, the cohorting of the child, like the small recess or when the child have a discussion, it is better to have a cohorting of the child so that we can identify that these are the cohort of the children. If any of the child gets infected, and we'll be able to know these are the 4 or 5 kids sit together and we can actually quarantine or isolate them. Yes, definitely we can use cafeteria with the appropriate precautions. Like there should be a good space, one thing. Second is windows should be open so that there is a good natural ventilation. If we are utilizing AC, it should be cleaned periodically so that it's not a source of infection. And third thing is, use small tables like 4 to 5 kids sitting on one table so that there is a cohorting, because during the lunch time they open their mask, and so that we have to make it sure they are not coming in contact with many children rather than they are cohorting themselves, so that we can identify if any of the child gets COVID infection. Remember, most of the kids are having mildly symptomatic or asymptomatic infection. As per the current guidelines, we have to home isolate them for 5 days. After 5 days, if they are asymptomatic, they can rejoin the school following the appropriate social distancing, hand hygiene as well as masking. And if they keep on developing the symptoms even after 5 days, then kindly remember to visit your pediatrician immediately. So current definition of the contact is that the child came in contact with the positive child for more than 15 minutes when both of them are not using the mask. If both are using the mask, the chances of getting an infection are very unlikely. So remember, masking is really important. But if they came in a contact with that child, we can monitor them at home if it is possible. But if they don't have any symptoms and they're absolutely fine, they can still go to the school following the appropriate social distancing, masking and hand sanitization. At any point of time, if they develop a symptoms, they should go for home isolation or home quarantine. The child who actually finished 5 days of home quarantine can come to the school and follow the similar social distancing, hand sanitization and masking policy to prevent infection of the other child. In conclusion, we feel that we are not going to see the fourth wave, but we are going to see the spurts of infection. And remember, we are not going anywhere from this infection. We are going to have this virus for a pretty long time, and over the time, we might have to take the vaccination every yearly also. So here, we have to remember that the things which has protected us since the last 3 waves are social distancing, mask and hand sanitization. We can use appropriate facilities at this moment to curtail the infection of COVID in school and in school premises as well as during the transportation.